Okay, so you're wondering what CCL or TPLO recovery really looks like. I'm going to break down recovery into 3 phases. The first phase, and these aren't veterinary phases, these are like Carla phases. These are real life. Weeks 1 and 2. Weeks 6 through 8. And then weeks, 9 on. Week 1, the suckiest phase of all. You will question everything. Even if you are really tough, you'll probably cry. I did lots of times. You'll second guess everything. Am I doing the meds right? Why isn't my dog touching their foot to the ground? Everybody else's dog is touching their foot to the ground. Am I using the harness the right way? How do I get my dog up when they're refusing to move? I know they need to pee by now. Why are they not eating? If they're not eating and the meds say give with food, now what do I do? Like, this is week 1. Uncertainty to the max. Stress to the max. No sleeping or fragmented sleep. Which is why I'll just give you a little hint. You want to get really good sleep, because I'll tell you, emotionally, you're going to be pulled in so many different angles, right? You're going to be pulled in so many different directions. You're going to be emotionally frail. So do your best to get good sleep. And my recommendation for that is to get a crib mattress or your bed mattress, pull it off the frame, stick it on the ground, and sleep with your dog. And that's especially true if your dog is used to sleeping with you. Weeks 6 through 8. This is when the vets are going to start thinking, okay, we're going to check your dog and see how well they're healing. We'll do that with a physical exam, but also with x-rays. It's not a money grab. Some people are like, they just want more money. And it's like, no, not really. They want to make sure your dog's not infected. They want to make sure the bone looks healthy, that the implants are where they belong, that the rotation isn't being lost if they got TPLO, that everything is nice and secure, and that the bone cut is healing. The way to see that for sure is by x-ray. You'll be able to see that curved cut where they cut the tibia. You'll be able to see that filling in with new bone. It's actually really cool to see. So yeah, that's weeks 6 through 8. Not every person does 8-week radiographs, but that is kind of the norm.
Coming on your left there.
Got you. Have a good one.
Thank you. I don't like flash. Thank you.
Sure. If you're going online and you're watching other people's accounts of their dog's TPLO recovery, let's say on YouTube, and you're like, their dog is at 6 weeks or 2 weeks, and look at how they're using their leg. Well, why isn't my dog doing that? Is the surgery failing? What's wrong? What did I do wrong? Every dog heals differently, and it depends on their previous medical history, if they have underlying conditions, how old they are, the skill of your vet, and how well they did the surgery. There's just so much that goes into it. So just try to not compare your dog to others and just accept what you get day by day. As long as your dog is showing signs of continued progression in their healing, like they're putting a little bit more weight on their leg, they're not showing any new interest in licking their knee, or a new or worsening limp, a new onset of clicking that looks like it hurts because they're limping. And you guys, please, for the love of God, don't say my dog is limping, they have no pain. It's one of the most common Google searches, which is just confounding because your dog is limping because they're in pain. So if you see your dog doing well, they're healing, and then all of a sudden they're not using their leg, or they're starting to limp, they're looking at their knee, they're licking their knee, it means time to call the vet. You can take a video and send it to your vet team. You can take pictures if it's something that you think a picture could capture. Make sure if you do take a picture that it's clear, because these really, really close-up ones that I've seen are blurry. and that's not going to do the vet any good. They're going to just say, well, let's schedule an appointment. But if you send a good video, or if you send a really focused picture, then that's great. One of the things I recommend is getting video from different angles, so some behind your dog. And slow motion is like magic, because normal speed, it's kind of hard to see and pick up these subtle nuances, but slow motion, you'll be able to tell, okay, I see them getting better. Also get some video views from the surgery side, and that might mean having you walking your dog or somebody else walking your dog, and then you doing the video, since you know what to look for, or flip it around. You walk the dog and they video, it doesn't matter, just do a good video. So yeah, worsening lameness, that's an issue. And then of course, if the knee is swelling, if you see any kind of discharge from the incision, that is not normal. Well, I shouldn't say that. Let me clarify that. Drainage from the incision is normal after CCL surgery for the first week, but not week 3 and 4 and 5 and on. If you see drainage in that case, then you might be looking at an infection. And a quick win here is that when it comes to a suspected infection, you don't wait. You don't say, well, let me just see what this looks like tomorrow. Because tomorrow, that little red dot that you see might have burst. Or that little bit of drainage that just looked wet might have pus. So time is of the essence with that. Now, as your dog is healing through the latter stages, after the bone has healed, after the vet's saying, okay, now, bone is healed enough, you can resume normal activity. That doesn't mean you go play fetch with the dog. You're going to want to, and I get it, but don't do it, because that leg is still very weak. And so what you'll see is when you start taking those first walks, your dog's leg will be maybe shaking a little bit after. It's just muscle weakness, don't worry. You might even notice that they limp. I want you to keep this in mind. Healing, and I would say this even for people, right? Healing isn't this linear thing. Like you start out really bad and injured and you have a fresh incision and a lot of pain and you just steadily improve. No. That's not how it goes. With people and pets too, healing is anything but linear. It has peaks where things seem like they're going great and everything is on target. And then you have these dips and these valleys where you're like, why is everything going wrong? Why do I feel like this is a setback? Okay? All right, so that's TPLO recovery in a nutshell. First weeks suck. Weeks 3-ish on, you're going to be feeling better. Weeks 6 through 8, the bone is really going to be showing signs of healing, steady healing, and maybe not, depending on your dog. And then take recovery slow. Look at what your vet says to do and just heed their advice. Don't go too fast, because although healing's not linear, you want to keep it from having flare-ups and remissions of pain and dysfunction. Let's say you go for a 15-minute walk and now they're limping the next day, or they're limping by that night. Instead of doing another 15-minute walk the next day, do a 10-minute walk and really start watching them at minute 9, 10. If they look like they're not limping, stop. It doesn't mean keep going and pass that 15-minute threshold and then they're limping again. You want to go in a slow, methodical increase with recovery. I think choosing where you walk is super smart. And I'm going to tell you that your dog is probably not ready for the dog park at week 12. They're probably not. And I say that because what happens a lot of times is that people go to the dog park because we're so excited. My God, we've been waiting forever. It feels like forever. 12 weeks is a long time for an active dog and owner combo. And now you're finally able to move, and now you still have to feel restricted, right? So you want to go to the dog park and see the other dogs. You want your dog to be back with their friends again. And sometimes there's that little rotter of a dog, the little troublemaker. And you know how it is at dog parks, where it's like letting 50 kindergartners on the loose and just saying, have at it. There are going to be little fights and scuffles and stuff. And I'll tell you that I don't know what it is, and an animal behaviorist would be able to, define this much more clearly and eloquently than I can. But the weak dog is sometimes targeted by other dogs. And this happens all throughout recovery. Week 1, week 2, people put their dogs, they'll be walking on the street, their dog gets attacked. So be very careful where you walk, and then just do a slow and gradual increase in activities. And pay attention to how they recover after, how they act, if they limp. Pay attention to all of that stuff. And if they're good, then, maybe in a couple of days you increase a little bit. But yeah, slow and steady wins the race. All right, guys, if you like this video, I would be so happy if you went to the playlist and kind of just binge watched with me. What's cool about the playlist is that it gives you one video after the next without any interruptions. If you have any questions, go ahead and put them in the comments section. And I want to show you this, because what in the heck is this? I've never seen this in all of my years here. I guess I'll flip my camera like this. How cute. I know they have one of these, I think it's in France, right? Wow. Oh, that's so sweet. It's like a tribute to that person. Look at that one. Oh my gosh. Well, I'm not sure what's going on with this person. Maybe they're very indecisive. All right, guys. There we go. All right, take care. Now you know what TPLO recovery weeks 1 through fully healed looks like. Good luck to you. You can do this.